see you. Sergeant Wells, glad you're here. The rest of you, I'm glad you're here. My name is Barbara Boswell, and I'm from Public Health Nursing. I'm one of the nurses up here who does a lot of education components, and today we're going to talk about diabetes. And since each of us have to deal with patients that have diabetes, it is always a good refresher to review what we need to know about diabetes just to keep our patients safe, because we are the gatekeeper for their safety and for their future health. So I want to talk to you what we need to know about blood glucose monitoring. First of all, let me tell you that I'm really new to the military, so some of the things I learned is that you can always call a sergeant a major, but you never call a major a sergeant.
Yes.
Yeah, kind of learned that the hard way. Anyway, let's get started on our educational component here. Objectives. What we're going to learn today is to learn who should have blood glucose monitoring done. Describe when it needs to be done. Does it need to be done in the middle of the night? When does it need to be done? Does it need to be done when someone has the hiccups? Yeah, we're going to learn about that. And how it is done safely and correctly. My lovely assistant here. There's your chest. Okay. All right, so let's get to monitoring the patient. I'm sorry, before we continue, there's a few rules that I would like to, if you would just, out of courtesy to me, just don't burp. Not particularly fond of nose picking either. You're over there in the corner. Mooney, keep your finger out of your nose, at least while you're in here. Thank you very much. Okay, blood glucose monitoring is an important tool in management of the patient with diabetes. We're all familiar, we're all in the medical field. That's not big duh, right? It is also used as a screening tool for newborns, for developmental, genetics, and metabolic disorders. So it's not just for the diabetic person, right? Blood glucose monitoring levels for the person who does not have diabetes, right? Could you think of an example when we would go ahead and, not necessarily us, but when another one would be done? I can think of one. When a person goes into surgery, or when they're in surgery for a long time, so you take someone who's been in surgery for 8 hours, 5 hours with not having any kind of fluid, but food, that would be a good time to go ahead and check what our blood glucose would be. Okay, the importance of blood glucose monitoring. Can we just say BGM? We probably can. We don't really know what that would mean. Okay, so we know that sugar is needed for every single cell in our body. There is not one cell that doesn't need energy. Correct? Right. I just answered it for you. Yes, that's true. Too much sugar can cause damage to all the organs in the body.
Especially in the eye.
Yes, in the eyes, that's right. And too little sugar can cause death immediately. Here's what I need to tell you. My situation was that I was a nursing student in Cleveland, Ohio, and one of our rotations, our clinical rotations, was that we had to be in a rehab facility. This rehab facility was huge. I don't remember how many beds there were in it, but I just remember it used to be an old TB, what do they call it? Institution.
Okay.
And so I was on the floor where everyone was pretty much comatose. So there were people getting accidents, but the one girl who really stood out to me was this beautiful, she was like 24 years old, and she was absolutely beautiful. And she was going to be in this vegetative state for the rest of her life. The reason why she was going to be in that vegetative state was because she was a diabetic. She had gotten a blood sugar that was too low, and either she wasn't aware of it, or there was no one else around. It didn't happen at nighttime. I remember that because I was thinking, oh, maybe it happened in her sleep. It didn't happen in her sleep. It was happening in the daytime, and her blood sugar had gone so low that she became comatose. So there was no sugar in any of the cells, including the brain cells. So she was going to be in a coma for the rest of her life. All because that a low blood sugar was not treated. So, exactly what we're saying, too little sugar can cause death immediately. Signs and symptoms. We can go over these. We already know it's going to cause sweating. Hypoglycemia can cause sweating, can cause hunger. Did you notice, if you look on both sides though, that hunger can be a sign of hypo and hyperglycemia. So, how do we know whether that person is hypo or hyperglycemia? Usually what will happen is that it won't go ahead and it will have other signs right along with it. So the person who is hypoglycemic will maybe have blurred vision, there might be tingling sensation around the mouth, there might be heart palpitations, it might be confusion, severe cases like we were talking about, the person will be unconscious or can have seizures. That usually doesn't happen with a hyperglycemia. You're not really going to find very much of, the sugars would have to be like in the 800 or the 900 range before they would become unconscious. So even though these two are the same, hunger and hyper and hypoglycemia, there will be other symptoms that go along with it. So it's important to know that with a hyperglycemia person, they're going to be the ones that have the really extreme thirst. They're going to have the frequent urination, which are some of the signs, right, of someone who's just being diagnosed with diabetes, right?
Mm-hmm.
Okay. Are you diabetic?
No.
Okay. You just know a lot about it.
Yes.
Way to go, way to go. Okay. Normal blood glucose 70 to 140. Hypoglycemia would be anything below 70. Hyperglycemia would be anything over 140. Next. Okay, treatment for these. Hyperglycemia, gonna drink plenty of fluids, give the water, tea, of course no sugar. Water is going to be the best thing though. Get this person to exercise, get them out and get them walking. I'm talking about the kind of normal person, the diabetic that is pretty much under control. And treatment would be, make sure that they're following that specific meal plan.
You know, when in the first one I said drink plenty of non-calorie food, when the people is like have a low blood sugar, what they do is like they want to give sugar to them. It's bad for them.
Right.
Yes, they need fruits. Fruits, it takes time to your body to digest it. And what happens is you gave them sugar, your body's gonna produce more insulin. It's gonna drop more your blood sugar.
That's right.
That's why you need fruit or some of food, not like artificial sugar for your body.
Right. There's another thing that goes right along with that is that when you're giving fruits, you should always have a protein with it. So if you're giving fruit like you're giving them strawberries or whatever, always make sure that it's some kind of a protein with it. So it would be cottage cheese, it would be yogurt, some string cheese, whatever, to go with that. Because what that does is when you add the protein to the fruit, it will keep the blood sugar even. All right, hypoglycemia. When that happens, we're going to give them 4 ounces of a regular soda. Protein meal. Use the 15-15 rule, and in case you didn't know what the 15-15 rule, Sergeant Wells, the other Sergeant Wells. Are you two married?
Yes.
Okay. The 15-15 rule is very important, and we always, it's recommended by the AADE and by the Kentucky Diabetes Association. Is what you do is you give, if a person has a blood sugar of 70 or below, you're going to give them 15 carbohydrates in 15 minutes. Then you're going to go ahead, after that 15 minutes, you'll go ahead and you check their blood sugar again. If it's still below 70, you'll give them another 15 carbs, fast-acting carbs, in 15 minutes. And then we'll go ahead and test their blood sugar again. If it's still below 70, you've got another issue here and you really need immediate attention. So, right here, like it was monitoring Q15 minutes until it's greater than 70. And at the end of the class, I will go ahead and give you, actually, a little 15 fast-acting carbohydrates that is recommended. Okay, administer glucagon. Who knows what glucagon is? Please tell them, you already know.
Glucagon?
Mm-hmm. The shot?
The shot?
Mm-hmm.
Okay. Well, I know about that because, like, when you are pregnant, you're going to the labs, they're gonna give you glucagon to know your blood sugar level in your body.
Right, okay, that's correct. And we also use it for the person who is really having a low blood sugar. And that can be a lifesaver because it's just an injection that you put in. You get these from, a lot of diabetics carry them around with them. And it's just an injection that you give, and it's a fast-acting carbohydrate. The only thing with that is it acts really fast, and it can wake someone up like this. And it can be combative. You can actually always make sure you turn them over on their side as well because they wind up throwing up. So, okay, what's next? Okay, why do these episodes happen? This is kind of a no-brainer, right? Hyperglycemia, increased blood sugar, because you're eating too many sugary foods, liquids, eating a lot of carbs. Let's see, we had spaghetti for dinner, and then bread, oh, don't you know it. And then what did we have for dessert? We had chocolate brownies. And what did we have to drink?
A Coke.
A Coke, right, okay. Will that make the blood sugar up? Yeah. Not exercising. For someone who is on a regular exercise routine, like all the green suiters in here, going ahead and exercising, you got this routine going every morning, you're up. How long do you exercise in the morning when you do your PT?
About an hour.
Wow.
Okay. Is it structured that you take an hour and do it?
Yeah.
Okay. So suddenly you're not doing this. You're getting up in the morning, not doing it. You're eating. You have that pancake waffle, right? A couple pieces of toast with jelly on it. Yeah. Okay. Forgetting to take medication or not taking them as prescribed. Okay. Let's see. I take one of these pills that will increase my insulin. I won't take it today. I don't feel like taking it today. Okay. Illness and infection will increase your blood sugars.
It's because of the antibiotics.
That's right. Medications. That's right. Medications can do that. So I should have medications up here as well, not just illness and infection. Thank you very much.
What?
I will correct that. Hypoglycemia. Drinking the alcohol on an empty stomach. Delayed meals. Unplanned strenuous activities. Okay. Yeah, you're really working out now. You're working out 2 hours. Or not eating enough. Or taking too much of the diabetes medicines. Yeah. Just taking too much of it.
Yeah, because sometimes you delay your meals, you delay your meal, you think because you're eating too much in that moment, you need more dose, that's why you have hypoglycemia, because you are probably like you are putting in your body more insulin than carbohydrate that you have in your body. That's why you're gonna feel after you eat, you have the chocolate insulin, you're gonna feel the same symptom.
Did I tell you that you rock? All right. Okay, monitoring of blood glucose sugars is individualized. Okay, for the person who has diabetes, it's depending on what the doctor's recommending. The usual recommendations that we were doing up here for our adults is that we would encourage them to check their blood glucose an hour before they're going to eat and then an hour after. And that was our recommendation up here, but really it is individualized by the provider. Okay, monitoring of blood glucose sugar shows how food, medication, infection, stress, activity affects the blood glucose. So that's another reason why we would do it. It's an indicator of need for a medication change, right? So the person's on medication for diabetes, whether it's to increase the insulin production, it's an indicator for whether they're going to need more or not, or less, hopefully less. By the way, is diabetes curable?
No.
No. It's not curable. Is it controllable? Yes.
Mm-hmm.
It's a monitor for a life and death situation. Actually, this is not a situation. It's a how do we pronounce this? It's not a T there. There's a Y. Vibration. Okay. I don't know who made this up, but there you go. They should have corrected that before they went ahead and taught this class. Okay. All right. What's next? And these are our references. As you can see, we only use the top one. The American Diabetes Association.
I'm thinking that we have a lot of diabetes, but it's because of our diet. We have a problem with obesity. We have a problem with obesity, the people that eat too much, that's why we have
Absolutely. Absolutely. And now they're saying that about 66% of the population is going to wind up being obese.
Yeah, because they don't take care of this. That's why.
So, American Association of Diabetes Educators, our favorite, the Department of Defense Patient Toolkit Guide, the Cranes Patient Education, and the Mayo Clinic. What I would like to do, though, as long as we have time, these are given to us by a pharmacy company, and I'm sure it's not because they want to sell them or anything, but I wanted just to give everyone one of the fast-acting glucose gels that they are recommending. I have to tell you though, these are great, but for the average person who can't afford to buy these, you can use Lifesavers. You can use like 5 Lifesavers. The other thing is you can use the frosting. It's just like the frosting that you write on cakes with. You can just keep one of those little tubes in that, and then you just go ahead and put it on the cheek.
Right. Do that, I don't even have diabetes.
Right. So here, I just wanted to pass these out to everyone. Here, you can just pass these around, please.
Thank you.
Mm-hmm. Sergeant Chuck, there's one for you.
Thank you. I'm sorry.
Mandarin.
Mandarin one.
Yeah.
And just if you wanted to, I already have one open. If you just want to taste to see how much sugar is in it, I mean, I just take a little bit on my fingertip and think of putting the whole thing in your mouth. That's really good. So, it's really, really sweet. Let's see what's in here. Oh,
It's like Fanta. It's good. I like it.
the whole thing? But you couldn't do the whole thing, though.
No, I
Yeah, right?
No, it was really good. The taste.
Get close to each one.
Okay, are there any questions? No questions?
No.
Thank you for coming to this presentation, and it is a pleasure to work with all of you. Apply for yourself.